Reverend Hardy Smallwood went from the Korean War to a boxing career, later serving as an NYPD chaplain until he landed in a nursing home.
I'm gonna walk in Jerusalem.
His 10 children serenaded him on his 85th birthday.
I want to be ready.
But when he passed away in late April, his family couldn't be there.
It broke my heart that I wasn't able to bury him and give him a send-off.
Out on Long Island, Lori Sullivan put on protective gear and demanded to see her sick mother at Our Lady of Consolation Rehab Center.
She asked me for water, and I realized that it wasn't her water pitcher on the table. It was from room 215D, and my mother was 205W.
It was someone else's water pitcher?
Someone else's water pitcher.
Lorraine Sullivan died a week later.
Catholic Health Services, which runs Our Lady of Consolation and some other facilities, said that it's been vigilant in monitoring staff and residents for symptoms of COVID-19, and that it's also enhanced safety measures during the pandemic.
Yet Governor Cuomo had warned no nursing home could be hermetically sealed.
It just takes one staff member who didn't have a temperature but did have the virus to walk in.
Across the river in New Jersey, 40% of the COVID-19 deaths happened in long-term care facilities. The National Guard even called in after 17 bodies were found piled up in one room at the Andover Rehab Center.
You can almost smell despair in the air.
In New York, just over 20% of COVID-19 deaths happened in nursing homes, far less than New Jersey. Yet the death rate downstate has been staggering. 58 at Carmel Richmond Healthcare on Staten Island. 60 confirmed or presumed COVID deaths at Phoenix Rehabilitation and Nursing in Brooklyn. 63 at Plaza Rehab in the Bronx. 82 at Parker Jewish Institute near the Queens-Nassau border. The latest official death count at Isabella in Washington Heights is 67. Nursing assistant Rose Thomas worked at a Staten Island facility.
We definitely have more COVID residents than they were telling us.
And the State Department of Health confirmed to Pix 11 News its inspectors showed up unannounced at the Hebrew home in Riverdale May 10th to examine the medical records of deceased patients. The owners of the state's largest private facility refute claims that they drastically underreported coronavirus deaths. Stephen Hans represents more than 400 facilities statewide.
This virus is prevalent throughout New York State. And I would argue that the providers have been transparent in terms of reporting those. So I don't think it's a matter of bad for business.
Back in late February, when elderly residents at the Life Care Center in Seattle started getting sick with COVID, nursing home workers in New York did not see a correlation with increased fevers at their facilities.
We heard about COVID, but we didn't know the seriousness of it, the effects of it.
Yet by mid-March, the New York State Department of Health ordered all nursing homes locked down to visitors. Alexis Lewis works the overnight shift at the Linden Center in East New York.
We were told that there weren't any cases in the nursing home. When you see they just get sick and die, then we know we had cases.
At the same time, Governor Cuomo was dealing with the surge of sick patients headed to hospitals without enough beds. On March 25th, Cuomo's health commissioner issued a directive. Nursing homes could not refuse admission to COVID-19 patients returning from hospitals.
The focus was all on hospitals. But how can they forget about a vulnerable population?
On May 10th, Governor Cuomo reversed his earlier directive and said that no COVID-19 positive patient could be admitted to a nursing home.
He's the one who passed the mandate, and now it's kind of late for him to reverse it because the damage has been done.
The governor is redoubling efforts to safeguard adult care facilities, and we've learned 2,700 complaint investigations have been opened. In our next report, will families have the right to sue? I'm Mary Murphy, Pix 11 News.